Today's gut talk is all about hemorrhoid.
Hello folks, welcome to my channel, Straight from the Gut. This is Dr. Mia again, and I'm in between the cases, so I'm going to make a short educational video for you. One of the common conditions that patient sees me is for hemorrhoid problem. Hemorrhoid problem can cause a lot of issues, including from bleeding to discomfort to excessive discharge, and not to say the cosmetic or the aesthetic aspect of it. And there's not a single day I don't see patients for hemorrhoid. Now, some hemorrhoid needs to be treated by endoscopic means, some just by medical means, and some by surgical means. But part of hemorrhoid treatment is actually to know what hemorrhoid is and what are the types of hemorrhoid. So in today's talk, you will get to know everything about hemorrhoid. So to understand what hemorrhoids are and how they work, let's get a model of rectum. Imagine this is the model for our lower part of colon and the rectum and the anal canal. The rectum is the last part and the anal canal is through which we pass our stool or we poop. Hemorrhoids are nothing but varicose veins in the rectum and anal canal. The reason they protrude out because we have soft cushion of tissue in our lower part of the rectum and anal canal for reasonable reason, for accommodation when we move our bowel, but because of that they can protrude out and they can form hemorrhoids. If we lay the model of the rectum and the anal canal on the table, we can see there are two types of hemorrhoid. One is called external hemorrhoid and one is called internal hemorrhoid. Internal hemorrhoids are above an imaginary line, we call it dentate line. External hemorrhoids are below that line and generally they are lined by the skin surface. Now, because of the location of internal and external hemorrhoid, there is a big difference in their management because internal hemorrhoids are lined by the mucosa or the inner lining of the gastrointestinal tract, which is relatively insensitive. On the other hand, external hemorrhoid could be lined by the skin, which is the nerve where the nerve supply comes from somatic nervous system, which is exquisitely sensitive and could be very painful. How do we treat hemorrhoid? Hemorrhoids should be treated according to their location, according to their severity. If these are minor hemorrhoid, internal or external, they are causing minimum problem, minimum symptom, and patients are not bothered that much other than nuisance, then they are being treated by over-the-counter medication like preparation H, sitz bath, etc. If it doesn't help, we can give them higher dose of steroid, or for pain, we can give them local anesthetic. However, when hemorrhoids become complicated, by which we mean causes repeated and severe problem, causes bleeding, severe aesthetic problem, or gets strangulated, then we have to step up the treatment also. The non-invasive way to treat hemorrhoid will be endoscopic treatment, where we just apply rubber band, and after application of rubber band, it falls off. These rubber bands are really simple device. As you can see, a rubber band just deployed on a device and we deploy it on top of the scope. With that, we suck the hemorrhoid inside this circular device and then we slip the band at the base of the hemorrhoid. And once it deploys, the rubber band presses on it, so it eventually strangulates and falls off, thereby resolving the problem. However, the external hemorrhoid, which are lined by the skin, this method is not possible because this is extremely painful and almost to intolerable degree. In that case, failure of medical treatment will lead to recommendation of surgical treatment. Now, one has to be careful in surgical treatment because one of the rare complications of this surgery is accidental injury to the nerve of the sphincter. So one could become incontinent to their stool, possibly for rest of their life, unless some other treatment is being done. Well folks, I hope you got a primer about the hemorrhoid, how they are treated and what to do, what not to do with them. And if you like this talk, please subscribe and like my channel and my talks. In that way I can bring more of these educational talks for you. The subscription is right down there, and you can also take a look at my previous videos. I have a talk about should I take probiotics every day, or about constipation that I call empty colon syndrome, and about pancreatic cancer. So please check it out, subscribe to my channel, and once again, have a great day with the good knowledge.